journey is good. Lakini pia inahitaji sacrifice na inataka wakati kuredi.
Life is a journey, and every journey begins somewhere. Today, we are taking you through the journey of pregnancy. Join us as we converse with Dr. Duncan Otunga. My name is Brenda Obura.
ANC is initial. Those are initial for the word antenatal clinics. These are clinics that actually attended by pregnant ladies, so that we can actually advise them how they can actually take care of the pregnancy before delivery.
Nilifanywa check-up kama mtoto ako sawa, then so hiyo process ya madaktari kumassage, then wanakuambia kuna yenye unafaa kutumia, yenye unafaa kunywa maji 8 glasses per day, yana kuna dawa zenye nilikuwa natumia nikiwa na bobo.
We don't have the specific time for a lady to start the antenatal clinic, but the moment we confirm she's pregnant, she's always advised to start the clinic to face out some of the complications that might be arise in the course of the journey of the pregnancy.
According to me, nilikuja kujua niko na ball after 1 month.
The first 1 month don't realize. Nilikuwa like ile unangoja your MPs as come, kuna venye una feel your nausea. Actually mimi niko like nikiattend wana feel your nausea ikikaribia. Na feel your nausea, una feel like na feel kulala. So nilidhani ni normal. Ni hiyo tu. But sasa nikaona masiku zinaendelea kupita, mwezi ndio inaisha. Nikasema wacha nifanye nini? Wacha nifanye pregnancy test. Ndio nikapata iko positive. Yeah.
Nilikuwa feel like malaria, then nikaenda hosi. Explain kwa daktari. Alafu wakanifanyia test ya pregnancy. Then wakaniambia niko na ball.
And nowadays we do encourage the ladies to attend or start the antenatal visits at a bit early. There are complications that normally arise depending on the trimesters. Some of the complications, maybe diabetes, gestational diabetes can be part of it. They are advised, or we advise them to do so, because we want to categorize them from the risk part of it. That those normally have the hypertension, that those sometimes they normally have a miscarriage at early, so we tend to advise them to start the clinic so that we can actually avoid the complications.
Of course kuna challenges, especially first trimester, kuna challenges. Personally nilikuwa na ile like your nausea in the morning. But ile yenye una feel nausea but hautapiki, haiwezi kuja. Like kuna perfumes, tuseme tu perfumes, sabuni na perfume, marashi nini, sikuwa tukua tunaingiana nazo.
Of course it was not easy, jo ni first time. Yeah, kuna hizo unapitia ni kama milima na mabonde, jo ni kitu yenye hujazoea. Then so according to me nilikuwa na feel like nilikuwa na morning sickness, kutapika, kuna chakula zenye sikuwa na kulanga. Yeah, like chipo. Vitu mingi sikuwa na kulanga, alafu nilikuwa nachukia watoto vijana, nachukia sana.
We may not call them complications, but those are conditions that normally happen during the journey of the pregnancy. Complications are like twinning. You find a lady, she hasn't started the clinic, and by virtue of actually assessing her, you find she's carrying multiple kids. twins. It might arise as a complication because when she wants to push now, she may not push. So by virtue of advising her to start the clinic earlier, you're able to advise her either for a CS or a normal delivery at early stage. Sometimes they normally get anemia. How will you know she's anemic? Unless now you do what? You do the HB. The HB is confirmed in the antenatal clinic. So we are able to know whether she's anemic. You start our medication early so that we don't have to get another complication during the pregnancy. Because if she's anemic, she may end up actually giving us a very low birth weight babies because of the low blood count.
Nikikuwa ndio karibia due, nile nye like ukitembea ujui, si unaona kama ulikuwa unasikia hii ni first time, ujui itakuhapenia aje, na unasikia watu wanasema inaweza kushika anywhere. Sasa nilikuwa tunatembea nikiwa prepared just in case of anything. But hiyo process yote yenye nilikuwa nangoja ilibidi tu mwenyewe nijipeleke juu sikukuwa na hiyo labor. I think the baby alikuwa bado anataka kukaa kwa tumbo. Ndio wakaenda ikabidi wakaforce nini hiyo kuinduce. Ndio ikabidi tu atoke.
Trimesters are categorized into 3 categories. We have the first, second, and the third. The first starts from the first month up to the third. Those how many weeks? Around 12 weeks. Then again from 12 weeks to the 24, those are the second. That's the second trimester. Then the last one is around 12 to 36. Then she push. As I said, a lady comes to us with the 24 weeks. That's a second trimester. So we normally classify depending with the gestation. Gestation ni ule muda. You see, the first month, the second, the third. From first place to the third, that's the first trimester. From the 4th month, around to how many weeks? Around to 24 weeks, 6 months. That's another trimester. And the last trimester now is from 24 up to 36. Some of them they normally go up to 40 weeks, around 10 months.
Okay.
Yeah, don't get surprised. It's normal. In most cases, go for 9 months. But before you do anything like induction, we have to know the gestation of that baby or the gestation of that pregnancy first. Induction, these are procedures being done in facilities or hospitals. You induce, the lady, she's actually due for the delivery, but we don't have any labor pains. So there are medications that you give so that you can do what she can actually go into labor.
Okay, according to me, nilikuanga naumwa na tumbo continuous hata before niende labor ward. So ikifika time ya labor, hata sikumwa na tumbo. Yeah, yangu ilikuwa tu nasema tu, ilikuwa tu sawa. Ni ile tu niliona dalili. Kuna venye niliona vitu zingine si kawaida. Unadhani ni periods lakini si periods kivyangu, lakini sikumwa na tumbo. So nilienda hosi, then nikafanyiwa check up, nikaambiwa tutako karibu.
Actually nilitoka kwa nyumba sikuwa na pain, but kufika huko kufanyiwa scan kuonyesha ni that very day. So wakaniambia itabidi wafanye nini? Wa induce. So wakisha induce hiyo dawa, ikianza kufanya kazi, si jambo la kucheka. It's very painful. Hiyo kuumwa nini? Actually mimi nakumbuka niliumwa the whole night. Hadi asubuhi yake tena bado wanaongeza hiyo dawa, bado wanataka hiyo njia ifunguke. Actually kufika njia imefunguka, mtoto amechoka, heartbeat ya mtoto imeanza kuchoka. Sasa ikakuwa emergency case.
There are variety of the tests to be done, and they are categorized. We have the urinalysis. Urinalysis is a test we actually examine or investigate about the urine. We want to check if the lady she's having any infection in the urine, because if she has, it might cause miscarriage, especially at the first trimester. The second of the test is about the HB. HB is hemoglobin in full. We want to see if this lady, the level of the blood, if it's low, we need to put on iron supplements. And not only iron supplement, even the dietary part of it, so that she can easily pull up the blood. Before she got delivery, she's able to withstand everything. Because sometimes they normally bleed. Another thing is about syphilis. We normally test for syphilis so that we be sure it doesn't cross to the newborn baby. HIV, some of them are exposed. Now, if the lady is actually HIV positive, we have to be very careful. We start on HIV drugs so that the kid doesn't get the virus. But in case the mom is already a victim, a non-positive KP, then we put her on medication. Then we also advise her, by the time she'll be going to push, she gets the medication for the baby so that the baby doesn't get the virus. RBS, the sugar level, we want to rule out macrosomias. Some of the ladies, they push macrosomic babies, watoto wakubwa. So in such a scenario, you have actually again also to be very careful for the sugar levels, and we advise on the dietary. Another test that can be done is hepatitis B. Hepatitis B, we don't want the baby to get the hepatitis B. Another test that we can do, the blood group. We need to know the blood group of the mother so that we don't get isoimmunization of the blood. Sometimes you find the baby is actually carrying a different blood. And here is now where you get even the paternal blood. Because, for example, now a patient comes to us. She's a lady. Let me use an example of our patient. Maybe she's Mary. Mary works to us in the first trimester, and she's actually blood group what? Blood group AB. This part of the blood group called rhesus. We have to know first, is she rhesus negative or positive? Then if she is rhesus negative, we normally advise her, or we normally advise them, she get an injection called anti-D so that we don't have any agglutination of the blood during deliveries. We need to know her blood group, especially if the lady is going for a cesarean section. And this lady is anemic. Being anemic means you are not able, you don't have enough of the blood. And in case you go to now a CS table, we need to transfuse you. And how will we transfuse you if you don't know the blood group? Very important.
Around 1 ndo tukaenda theater. But ukishashika mtoto kuna venye unasahau hiyo pain.
On the part of the dietary, of course, if you want a healthy baby, you need to eat healthy. And pregnancy is like a journey. So on the dietary part of it, we advise them to eat healthy foods, and not all the foods. Because even some of them, they do take alcohol. But in this scenario, you have to advise them not to sip the alcohol content. The bone of contention is, we don't sip alcohol, especially if somebody is pregnant. Because it might cause some complication. You can imagine a lady comes to you to push and she's drunk. I've met them here. So back to the kind of food they need to take. We have the vegetables, the fruits, even the nuts, the legumes, and the dairy products, the milk, the poultry, the eggs. Those are kind of the food we need to advise them to be taking. More the vegetables, they are actually good to boost the immunity. The first trimester is very critical because the embryogenesis is still taking place. When I talk of embryogenesis, this is a period where now the baby, the formation of the baby, the embryogenesis. Yes, and such as now if you do a scan, you will always find the baby is not fully formed. We just have some blood content in the uterus. It's critical because the baby is not fully formed. And the cervix here, it might actually end up actually doing what? Opening, and we may end up losing the baby easily because we only have the bloody content in the uterus. Unlike the second and the third trimester where now the baby has already started forming like that.
Kuna ile time yenye like ukishaenda clinic, kuna zile vitu zingine unaambiwa ikifika like 5 months mtoto anafaa kuwa na mwili. Ya hiyo ilikuwa normal kwangu. Si uchungu, kuna ile time ya kikik, of course utasikia like kuna ka pain. Hiyo side yenye atakuwa ni kikik utasikia uchungu kidogo, lakini still too much pain.
Not only just bleeding, even the fever. Sometimes unakuta mama anakuja and you find yeye mwili wake ni moto, and that's the word they normally use. Mwili ni moto. Sometimes there is no fetal movement. Those are danger signs in pregnancy. Convulsions, they twitch, and when a lady twitch, it gives you a red flag. We advise them to start the clinic immediately if we find one was not started the clinic, and we put her on the medication, take the pressure, look at the NC book, the book they normally work with, check if everything is actually being done. If not done, kindly please start the NC immediately. Monitor the pressure. If the pressure is high, put her on medication to avoid the convulsions. If you find one who is bleeding, kindly put her on bed. Do the scanning whether you still have the viability of the pregnancy or the baby, then you put her on the medication as per the investigation.
Then mimba ilinifanya nikachukia baba mtoto. Nile kuongea lakini hadi tukosane. So pia yeye alini accept venye nilikuwa ya. Lakini kitu ilikuwa imeniweka kwake sana. Kuna nguo yake nilikuwa napenda sana. Hiyo nguo nilikuwa nashindanga tu naye at least niinuse, lakini yeye mwenyewe sikuwa namtaka.
Pregnancy is a journey, very tricky indeed. It's all about hormones. These ladies, they are being actually, when somebody is pregnant, it's all about hormonal issues. Progesterone takes shape, the estrogen goes down. So you find she tends to be very, very categorical. I want so and so, not this one. I want this kind of meal and not this one. After the delivery, everything is fine, back to normal. As a medic, I advise most of the pregnant ladies to start their antenatal clinic at an early age. The moment you notice you are pregnant, kindly please go to the nearby facility of your choice. Start the NC clinic immediately. You'll be advised on the danger signs of pregnancy, when to and how you can carry along pregnancy. Because the pregnancy is a journey that involves all the medic, the lady, and the immediate family. Please.
Nilifanyika kuna mawe. Ni mtoto alikuwa anataka, it was not me, of course. Yeah, maybe nilipendelewa kwa hiyo.
Sidhani kama kuna yenye ilinifanyikia, kama hiyo ya chakula, kama sijui lazima ukule kama mchanga, mimi sikuwahi kula mchanga. Sijui unachukia mtu, sikuwa na hiyo, though pregnancy inakuanga different. Unaweza experience, the first one is experience, another one experience tofauti. Sasa siwezi sema maybe wenye wanasema hivi iko wrong ama nini, but personally hakuna yenye nimesikia kama hiyo ya kukula ni lazima ukule, siku experience.
Cravings are always part of the journey of the pregnancy. You find a lady, she's pregnant and she tends to crave. Crave is a scenario where the lady prefers certain kind of food or meal towards the other one. And they tend to eat this kind of stones. Those stones are iron. And when you see a lady, they tend to crave on the iron part of it. We advise them to take plenty of the iron supplement. We have the tabs called the IFAS. IFAS contain the iron. Those stones, the iron. Not only the iron tabs we give, because we not put this lady on iron supplement forever. We also supplement the diet part of it. The organ meats, the liver, we together. Yes, the spinach, those are iron-rich foods for these ladies, and they do wonders. But whenever they come to us, we never tell them, you don't have to take those kind of stones. You might take a stone, and this stone is not clean. Somebody keeps on netting on the stone, and you are busy. And you are busy. I had forgotten about the NC part of the HB. When we do the HB and we found the iron, the level of the blood is a bit low, we tend to advise them to take the iron supplement. And there are those drugs that we normally give, the folic and the ferrous, but we normally call them IFAS. They are combined tablets that has both the two tablets, the two components, the folic part of it and the iron. The iron, it boosts the level of the blood, and the folic actually denatures the spine. There are those complications that ladies normally get, or the pregnant ladies normally get, if they don't take the folic supplements. You find a baby with a big head, spinal bifida, macrosomia, those kind of conditions. Hemorrhoids normally come at the end of the pregnancy, because now a lady goes to push, And as she is pushing the baby, she normally gets the hemorrhoid sometime. Hemorrhoid, in short, is a condition that normally manifests in pregnancy, especially the third trimester. And we have types of hemorrhoids. You have the external and the internal hemorrhoids. The internal one, we normally have a small growth just adjacent or below the anal area or the anal opening. But the external, you are able to see those kind of swelling at the anal area. Treatment is what depends with the classification. For the internal one, we normally have the creams, the anal supposed to that you normally push them. But before you do that, you have to do a DRE. You are able to ascertain if you are dealing with internal or external. But for the external one, we give just cream to smear on top of the swelling. It goes away. On top of that, we advise them to take laxative. Laxative, those are drugs that actually make the stool not to be very hard, because if the stool is very hard when she or he is going for the long haul, you find again the hemorrhoids comes out. So the latter is also very essential. The pawpaw is a laxative. It tends to soften the stool so that when the patient goes to the toilet, he or she is able to actually pass loose stools. And we encourage to take plenty of water indeed. In the journey of the pregnancy, we still advise the lady to be accompanied by the husband if she has one. For the psychological part of it, we tend to encourage them, especially during the third trimester.
First clinic, nikaenda na baba mtoto.
Actually, sometimes tulikuwa naenda nikiwa na yeye, but sometimes kama ako busy, najipeleka tu mwenyewe.
Ilikuwa tu sawa. Juu ukienda clinic na mwanaume atakao uko na mtoto, unakuwa the first kufanyiwa hata wengine. Juu, so I don't know, madaktari wanachukuanga mwanaume anafaa kuheshimiwa juu. I don't know, siko I understand. Juu tulienda na yeye, of course kuna wenye kwa laini, nilitangulia mbele yao na nikawacha.
Actually, nikienda na yeye, kuna tu venye una feel at least anakusupport, unaona? Mko in that journey together. But pia kuenda na yeye kutoenda na yeye ni mzuri tu, yes, lakini tuseme maybe unaweza taka assistant mahali fulani. Unajua ukikuwa na ball, kuna venye una feel kwenda washroom kila saa, short call, maybe anaweza kusaidia vitu umebeba, lakini kama hauko na yeye, unaona, inabidi tu jitume peke yako.
On the journey of the pregnancy, again, the first trimester, there are those tests that we normally do them. Like now the urinalysis, the HIV. These are scenarios where you find the lady is HIV negative and the fiance is positive. Now, if the fiance left at home, how will you know the fiance is positive? So we normally tend to do the filter in the clinic so that we are able to actually to get the husband. We do the HIV test. If he actually is positive, we put the gentleman on the tablets for the nurturing of that pregnancy. In the third trimester, almost to the delivery, we still encourage them again to accompany the husband so that when they go to the delivery room, the psychological support, the music can play a very important and vital role in the delivery room. You can get HIV from any corners, not only just those sexual intercourse. I'm a man and my wife is negative. Maybe I went to hospital and unfortunately I was transfused, blood is not screened. You see how I've gotten it. We share blades along the way. Those are some of the things that can happen. Not only that sexual intercourse. She can be negative and I'm positive. And we are married, we are a couple. At times even you can get a lady is positive and a man is negative. These cases I've actually seen them here. A lady was actually positive and the man was negative. And this lady was actually on treatment or on the drugs. And she was even carrying hard drugs. She was even carrying drugs for the baby. So after delivery, we cancelled the lady, and the lady accepted to give them the kid the drugs, and we gave the kid the drugs. But the saddest part of it, the husband didn't know the lady is positive. It was actually a very task so that we can advise this mzee to run for the test. But when we did the test, we found it was negative. We booked a clinic with him so that we can actually advise him about the status, the wife. By this scenario, do you have to disclose the status of the wife? So we had to keep quiet on that. True. But I talked to the husband, keep on checking the status of your family. Because if we end up telling the husband the wife is positive, very, 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 very tricky thing. Not only one, I've met like 3 to 4 cases.
Like pregnancy inataka like kuna medication to some point. Kuna venye unastahili kule vizuri, si kama vile kama sasa hivi unaweza kula breakfast, lunch, sapa kuna meal hapo katikati unastahili, unaona? Pia unastahili preparation, the baby is coming. Atavaa nini, atakula nini? Hiyo preparations unaona, in all generally inataka pesa na psychologically ukwe prepared kwa sababu kuna umemaliza journey ya pregnancy. Pia journey ya pregnancy si easy. Kuna time usikii kukaa, usikii kuamka, usikii kulala, unaona? Maybe hauna usingizi. Kama mimi mwisho sikuanga na usingizi. Ukienda kupambazuka ndio nasikia sasa kulala. Sometimes ukilala this side unasikia ukilala this side unasikia so naona hiyo pia inataka sacrifice, si kama vile ulikuwa mwanzo. Aya, the baby ndio huyu sasa amefika hapo. Hizo few months before breastfeed kuna time inakuwa uchungu, but with time na heal. Kuna time katoto kanaumwa na tumbo, maybe your digestion, so unajua kamekuwa kana kudipendia akiwa kwa tumbo, but now anajidependia anakula, so hiyo digestion lazima anakunywa maziwa kitambo azoeane system yake izo hiyo chakula yenye unampatia. Kuna ka problem hapo kwa na tumbo.
We are in Udhiru Ward, Kabete Sub-County in Kiambu County. We offer the maternal services. We also have the consultation services, dental treatment both inpatient and outpatient. The laboratory services, we also have them. The antenatal clinics, those ones that we have actually discussed. The maternal, again, postnatal clinics, these are clinics that we normally offer, especially if the mother has already given birth. We also have the family planning part of it, and the scan and the dental part of it. There are many drugs. One of them is Buscopan. Buscopan actually tends to ripen the cervix of that patient or the pregnant lady. And then you can imagine a scenario where she is pregnant to you, she comes and you give the Buscopan. It ripens the cervix, but we normally use it to ripen the cervix if she is in labor. But if she's not in labor, we don't give Buscopan tablets. L tablets, we have tablets that are called L, those are antimalarials, and artemether they are not also not good to be given. So for them, we tend to give SP. SP, those are fancied up, very smart to be used especially for the malaria management, and the quinine. But artemether L tabs, commonly used over the counter, not good for the pregnancy journey. We have actually the hospital phone numbers. I think if you allow me, I can give 0715 623030.